We would like to thank JACS for the opportunity to present our study, Coronary Artery Calcification and Risk of Cardiac Complications in the Geriatric Trauma Population, a study performed at UT Medical Center, Knoxville. The geriatric population, a demographic at higher risk for non-trauma-related complications, is growing, and more patients over the age of 65 are experiencing traumatic injuries. Coronary artery calcification, a predictor of cardiac complications and mortality in medical fields other than trauma, is reported by radiologists using a semi-quantitative score on routine chest CT scans at our hospital. A prospective cohort study was used to correlate coronary artery calcification severity and development of in-hospital cardiac complications, which we defined as STEMI, NSTEMI, cardiogenic shock, cardiac arrest, development of a new arrhythmia, in-hospital congestive heart failure or pulmonary edema, and/or cardiac mortality. Patients with no or mild coronary artery disease were compared to those with moderate to severe coronary artery calcification. Of the 557 patients analyzed, 97% had no or mild coronary artery calcification, and 21% had moderate to severe calcification. A total of 101 patients, or 18% of the cohort, experienced at least one cardiac complication. Of significance, patients in the moderate to severe calcification group had a 1.8 times higher incidence of cardiac complications compared to those in the no or mild cardiac calcification group. Patients with moderate to severe coronary artery calcification also had significantly higher incidences of STEMI, NSTEMI, in-hospital congestive heart failure, cardiogenic shock, and cardiac-related mortality. Quickly identifying patients who have higher risk of cardiac complications can decrease morbidity and mortality. Coronary artery calcification on chest CT scans demonstrated that higher severity of calcification had almost double the risk of cardiac complication. Overall, our findings suggest that semi-quantitative scoring of coronary artery calcification is an effective cardiac risk stratification tool. We highly recommend routine quantification of coronary artery calcification on chest CT by radiologists for elderly trauma patients to mitigate cardiac morbidity and mortality. Considering these results when making clinical decisions could help identify patients that would benefit from heightened surveillance and/or more intensive treatment.